I chose to get the COVID-19 vaccine for a couple reasons. The two most important reasons are to, one, protect those people around me, but I also believe that there's an important aspect of leadership in medicine where we have to show others what is the right step. So for me, it was protection, obviously, from what the vaccine allows us to protect ourselves and others, but it's also to lead the way for the development of our protections for our community. So with regard to side effects of the COVID-19 vaccine, I had two. I had a sore arm, and I had this really strange yet amazing warm feeling all over my body, which is very similar to what happened to me when I was a kid on Christmas Day, what usually happens to me around my birthday time parties, or sometimes what happens when I'm fishing and I'm about to catch a fish. And it's a beautiful feeling of hope and joy. So I had two side effects. Really the only main side effect I had was a sore arm, but it is a really nice feeling to know that you're able to get the vaccine. So as a physician, any choice that patients have to be engaged in with regards to a therapy or a treatment, I always tell patients that they need to make an informed decision. So for physicians and physicians like myself, getting an informed decision is the most important thing that anyone can do about any treatment modality that they may be entertaining. Most particularly with the COVID-19 vaccine, an informed decision is very, very important. There's a lot of information and at times misinformation that is being propagated. So always, always, always reach out to your healthcare professional. I know the health department also has set up a call line so that you can get the best information, the most accurate information, so that you can make a decision for yourself. The vaccination is important to receive now for, I think, several reasons. Number one, obviously with what's occurring in our community, with the amount of people who are getting sick, unfortunately those people who are being hospitalized, even worse than that, those who are ending up in our ICUs, and some of those who are dying. So one, to protect yourself and your community. We also know that it's important to get vaccinated now because as the vaccine continues to be rolled out, if you don't take your opportunity now, there's no guarantee that you may not go to the end of the list, and it may be a while before the vaccine becomes available to you again. It is important, however, again, to make sure that you are fully on board with receiving that vaccine, which gets back to, again, making sure that you have an informed decision so that you can make the right decision for yourself. And again, it's a real tight timing issue, making sure you have enough information, because when your opportunity comes, there's no guarantees of when that opportunity may come back around again. So it is very challenging right now. I think it's very important to continue wearing a mask after you've been vaccinated for a couple reasons. Number one, the studies that were done on the vaccination did not look to see if people could asymptomatically still spread the disease. The studies that were done on the vaccination were done to see if those people who got the vaccine would become symptomatic or not. So we still don't know if the vaccine will protect you from asymptomatically spreading infection to other people. Therefore, the mask is still important. That's the first thing. The second thing is that because the vaccine is not available to everyone, I think it is still very respectful for us, those of us who've been able to get the vaccine, to be understanding that other people haven't gotten the vaccine, and we should still model the behavior that, again, as healthcare leaders, we should be showing so that other people know what they should still do while they're waiting for their turn for the vaccine. We certainly wish that everyone could get the vaccine right off the bat. Unfortunately, that's not available and possible with the numbers of vaccines that are available. So those are the two main reasons to continue to use your mask even after being vaccinated. I got vaccinated for the community that I serve. Again, as a healthcare leader, I'm very fortunate to be able to get the vaccine. I feel safer, but to be honest, I feel very safe at wearing a mask, cleaning my hands, and staying socially distanced. I got the vaccine to lead our community out of this pandemic, and I hope that when the opportunity comes, you strongly consider it as well.